In a shocking incident that has shaken the British medical community, a Pakistani doctor left an operating room in the middle of surgery while his patient was under general anesthesia. He did so to engage in an inappropriate relationship with a nurse inside the hospital. According to The Guardian and other British media outlets, the doctor, Suhail Anjum, aged 44, was an anaesthetist working under the UK's National Health Service, or NHS. He was employed at Tameside and Glossop Integrated Care Hospital in Manchester. The incident dates back to September 16, 2023, when Dr. Anjum was overseeing a surgical procedure on a patient under full anesthesia. In the middle of the operation, he told the medical staff that he would take a short break, asking the nurses to monitor the patient during his absence. However, instead of heading to the break room, the doctor went to another room inside the hospital, where he met a nurse and engaged in an intimate act with her for about 8 minutes. All this occurred while the patient remained unconscious on the operating table. According to the investigation, another doctor entered the nearby operating room unexpectedly and found them in a compromising situation. The nurse was reportedly partially undressed, and the doctor was seen fastening his trousers, revealing what had taken place during working hours. Following the incident, Dr. Anjum was referred to a disciplinary tribunal under the General Medical Council. The council described his behavior as highly unethical and extremely serious, noting that he had left a patient in a vulnerable state for personal reasons. Despite this, the disciplinary panel later concluded that the risk of repeating such behavior was very low, and that the doctor had shown genuine remorse. As a result, he was not permanently banned from practicing medicine and was allowed to continue working after a temporary suspension. The decision sparked widespread debate across the medical and media sectors, with many criticizing the leniency of the ruling. They argued that such misconduct should never be tolerated, especially when a patient's safety is at stake. The tribunal's report stated that no direct physical harm had occurred to the patient and that the surgery was completed successfully. However, it emphasized that the act itself was deeply damaging to the integrity of the medical profession and public trust. Records show that Dr. Suhail Anjum, a married father of 3, had moved to the United Kingdom in 2011 and worked in several NHS hospitals. He was dismissed from his position in February 2024, following the hospital's internal investigation. During the disciplinary hearing held in September 2025 in Manchester, the doctor admitted his mistake, describing it as a moment of human weakness and poor judgment. He said he had been under extreme personal stress due to family issues, including the premature birth of his daughter and her critical health condition. However, despite his apology, public opinion largely rejected his explanation, viewing the tribunal's lenient decision as a damaging precedent that undermines accountability in the healthcare system. Currently, Dr. Anjum is residing in Pakistan after leaving the United Kingdom, though he has expressed his wish to return in the future to continue his medical career. In conclusion, British newspapers stated that this case has reignited debate about ethical oversight in the healthcare system and the urgent need for stricter standards to prevent such misconduct in an